Some other names for Turner syndrome are Bonnevier-Ullrich syndrome, gonadal dysgenesis, and monosomy X.
Turner syndrome is named after an endocrinologist, Henry Turner from Oklahoma City.
Henry Turner was the first to describe patients with Turner syndrome. In 1939, he treated 7 patients for dwarfism and lack of sexual development. However, these treatments were ineffective.
In London, 1959, Dr. Charles Ford and his colleagues discovered a chromosome abnormality. They found it in a karyotype of a 14-year-old girl with the characteristics described by Henry Turner. Sorry for the delay. I'm Miss Jackie.
Oh, I'm Elizabeth.
All right, nice to meet you. Nice to meet you. I understand that you have some concerns about your daughter's health and developmental issues. Would you care to explain them to me?
Sure. My daughter's 15. She hasn't had her first period or her first growth spurt yet. And she has unusual physical features that most of the girls her age don't have. So we were hoping you could examine her and identify what's causing these abnormalities.
Of course. Is it okay if I do a quick examination?
Yeah, sure.
All right, Zoe, will you please stand up? All right, you may sit down. I'm going to take a few notes and talk through what I've seen. So, I noticed that she has drooping eyelids and a short, wide neck, and it's a bit webbed. Have you seen the folds on her neck before?
Yes, we've seen those before, yeah.
All right, and she also has a very broad chest and is unusually short for her age. All these things are common symptoms of girls who have Turner syndrome. Do you know what that is?
No, I've never heard of that. Is that something that's inherited?
Well, conveniently you're holding a book that has a lot of information on Turner syndrome, but you can leaf through that and I will explain some of the things. Turner syndrome is not inherited and it only occurs in girls. It's not specific to any race or ethnic group. When a pair of sex chromosomes fails to separate during sperm or egg formation, it results in an embryo with only one X chromosome. Also, when the second sex chromosome is absent or deformed, so are the genes that it carries, and most of these genes are responsible for bone growth, estrogen levels, and so on. These can explain her broad shoulders as well as the other symptoms we discussed.
Okay. And how can you be completely sure that she has the disorder?
I can take some blood and run a few tests, if that's all right with you.
All right, sure.
Could you please roll up your sleeve? All right. When I get back from taking these, I would like to discuss the emotional impact and social impact that this has had on your daughter, okay?
Sure.
All right. We'll be right back. Okay, the test results will be back shortly. In the meantime, I would like to discuss the emotional and social issues that have stemmed from your physical appearance.
A lot of kids tease me at school. They think I'm mentally disabled because of my unusual physical features, even though I'm a straight A student. I also have low self-esteem compared to other kids my age.
I'm sorry, you have to go through that. You said you get straight A's, right?
Yes, I do.
Okay, well that's good. Girls with Turner syndrome aren't usually affected on intellectual level. But I have a couple questions for your mom. Can Zoe effectively communicate with nonverbal social cues?
For an example?
Like sarcasm.
No, she's not good at sarcasm.
Okay, well, that's common in a lot of girls with Turner syndrome. They can't communicate, non-verbally. Okay. I would like to discuss how this has had an impact on your family socially and emotionally.
It's tough to take Zoe in social places or public places because we get a lot of rude comments and stares, and sometimes it's hard for us to not get angry at those people.
Yeah.
It pains us to see our daughter struggle to make friends at school and stuff.
Okay, have you considered talking to a professional about constructive and efficient ways to explain to people that Zoe has a certain condition?
No, that'd be a good idea though, to see a professional. Yeah.
Alright, I just got a message saying that the test results are in. I'm gonna go get those and then we will discuss the results when I get back.
Alright.
So the test results came back positive for Turner syndrome. This is a lot to take in, I know. Seeing as only 1 out of every 2,500 girls have this disorder. But I think we should begin discussing treatments for Zoe immediately.
Alright, okay.
There are growth hormone injections that Zoe can take to increase her height by a few inches. We also have estrogen replacement therapy, which could help her develop breasts or other sexual development. Progesterone is sometimes given to girls who haven't begun menstruating by 15.
Okay. Are there any other problems we should be worried about?
Well, Turner syndrome patients often have high blood pressure, and if it's okay, could I take Zoe's blood pressure?
Yeah, that's no problem.
Thank you. So can you put this on your arm for me? Thank you. Alright, you may take it off. Thank you. Well, I noticed that her blood pressure is slightly high. This can be caused by narrowing of the aorta or kidney problems. So it'd be good to routinely check up on that. Also, these girls are more at risk for developing ear infections and thyroid problems. So I would recommend routine checkups for those as well.
Alright, is there a certain life expectancy for girls with this disorder?
Well, as long as you do routine checkups on those few symptoms, Zoe can live a relatively normal life.
Okay. Is it possible to replace the gene?
No, gene therapy is not possible for a Turner syndrome patient.
Okay.